a few minutes. One is actually we got two questions on vaginal estrogen. So, one is recently using vaginal estrogen to treat side effects from endocrine therapy has become controversial. Was there any discussion about its safety for use at the meeting? I think similar question on I'm curious what you know about treating women with vaginal estrogen for vaginal sexual side effects related to tamoxifen. Is it safe? Does it depend on your stage of breast cancer or such other factors?
Yeah, this is actually good. And it's funny because our group is actually holding a session internally to review all this data because it is a bit all over the map. And it's hard to do this kind of research to look at impact, because the question is if you give someone vaginal estrogen, it's the opposite of what we're trying to do, right? We're giving people hormone drugs to get rid of estrogen, to kill cancer cells that could be left behind. And you don't want to now give someone something that could stimulate cancer cells. But the question is it when you give vaginal estrogens, is it such a low amount of estrogen exposure that it doesn't matter? And there are formulations where I do think it probably doesn't matter. So we use sometimes these vaginal suppositories, like things like Vagifem, where I think the amount of estrogen that you're getting there is so low that it's probably fine. And most of the data suggests it is. However, when you use things like estrogen creams, where the exposure is a bit higher, that may not be as good of an idea. So, in general, our stance currently is we try to avoid anything estrogenic, but sometimes people do need it, and if so, then I go to something that has the least amount of estrogen exposure. Rather than use an estrogen cream, for example, we'll use something like a Vagifem tablet.
Okay, great. I think we need to wrap up. Maybe if we have 30 seconds, and actually, I'm not sure that